All right, so that is the patient who was being cared for at the Helen Joseph Hospital. And just before we talk to Mr. Mazibuko, who is a union leader for Nursing Union Denosa, let me tell you that Mr. London, who was treated there, we are told by the department through a statement that he was cared for at the facility for 14 days. And on Saturday, which was yesterday, he signed a refusal of treatment form and discharged himself from the hospital. All right, let's talk to Mr. Bongani Mazibuko now, the Secretary of Nursing Union Denosa. Mr. Mazibuko, good evening to you. Before we get into the nitty-gritties here, when you listen to a patient complaining like that, how does that make you feel as someone who represents healthcare workers in the province?
Good evening, Colin. And good evening to the viewers. It's quite sad and disheartening to hear such expressions from a patient who's supposed to be in the care of the department. And the people who make use of services of the Department of Health are the poor of the poor, people who are not able to access private health care and so forth. So it's very concerning and disheartening when you hear patients expressing dissatisfaction like this, especially when they say that they're not being treated like human beings. And that is the most basic right that we've got in the Constitution. So that is very concerning. Yeah.
Let's talk about the attitude of staff at Helen Joseph. First of all, perhaps it would be prudent for me to ask whether some of your members do indeed work at Helen Joseph Hospital.
Yep, it's correct. We do have staff members who work in Helen Joseph. And after the hearing of this video, we had contact with our shop stewards and some of the members on the ground. And we did get a bit of background on what is happening. We are confident that the investigation that has been launched by the Department of Health is actually going to show that nursing on their part have done their job, and they've done what they had to do in terms of what is expected in terms of nursing care and providing health care. But as I said, we would want to get the full report from the department, and then that would then give us a position to know who needs to be held accountable. But from what the patient is saying, it is quite obvious that there are people that needs to be held accountable, and there needs to be some kind of consequence management with that.
Yeah. The reason I ask about the attitude of the staff at Helen Joseph stems from what the department said in another statement, because they've since issued a myriad of statements on the back of this incident. And one of their statements says, 9 months ago in Gauteng, a campaign, almost it's an attitude sort of campaign. It says, I serve with a smile. This is directed towards staff, whether it be nurses or doctors, in order to change their attitudes. Do you believe that your members are living up to that particular campaign?
I know for a fact that they are trying to, but there are certain challenges or shortcomings that come with this campaign, which as Denosa we have shared with the MEC, and we have raised our concerns with management as well. Issues like infrastructure, shortage of medication, shortage of equipment and so forth. How are you expected to be able to serve with a smile when you are dealing with all of those? And if you look at the issues of staff shortage, which is a glaring challenge, the department has acknowledged it, and everybody knows that we've got a dire shortage of, but in particular, nurses and doctors in this country and in the province as well. It then makes it very difficult to be able to rise up to that level. But I know that the department is pushing forward with the I Serve with a Smile campaign. For us as Denosa, we feel that the I Serve with a Smile campaign should be accompanied with provision of proper working equipment, infrastructure. There should be improvements and it should be corrected. I think you would have seen in the video as well, where it shows that some of the infrastructure is not up to par. And issues of overcrowding. A few months ago, organized labor at the institution actually raised these concerns with management. And what has happened since then was that there was an interim team that was brought in. But that interim team has not brought in so much change that has made an impact on service delivery. So more needs to be done to support that particular hospital.
The reason I'm placing emphasis around this campaign, it stems from what Tom London says. This is the patient. What he does in that video, because it's the part that we shielded the viewers from seeing, but he points to a bed within a ward where he says, that person, they were alive some 20 minutes ago, but they have since died, and they are still there 20 minutes or so later. And he goes on then to show us just the state of disrepair in terms of infrastructure within the hospital. Do you think the I Serve with a Smile campaign has basically failed?
I would not go to that extent. There are certain people, as I said earlier, with the investigation would then show who is responsible for what. And as I said, I would want to say that I'm quite confident that from a nursing perspective, everything was done correctly. Just to give a bit of, from a nursing perspective, if a patient passes on, and at that time, I'm led to believe that it was around change of shift, so around 6:30. So the staff that was going out would not have been able to move the patient from the ward to the morgue at that time. So the shift that was coming in is the one that would then have had to move the patient. And rightly so, what they've done is they've made a screen to shield the patient that has passed on from the other patients so that it doesn't affect. And if you look on the video, it shows clearly that the curtains of all the patients in that particular cubicle have been closed. That is to make sure to try and prevent the other patients from being traumatized by seeing one of them having passed away. And
Mr. Mazibuko,
the issue, yes, sir.
Can I just interrupt you for a moment? Simply because the staff that was knocking off, I suppose they couldn't delay their knock-off time for, I don't know, how many minutes does it take to remove someone who has passed away with dignity, not expose them. Yes, they had tried to put sort of a shield around that person, but it is frankly frightening for anyone within the ward to know that they are in a room with someone who has just died. Would it have taken so much out of them to move that person out with dignity to wherever they needed to be taken, or because they were knocking off, it was someone else's job to do?
That's why I was saying to you that the investigation will reveal much more of this. It's not the responsibility of the nurses to remove the patient who has passed on. The nurses lay the patient that has passed on, and then you then need to call in the porters, and then the porters are the ones that would then move the patient from the ward to the morgue. And now we then need to get to understand, which is something that we are not privy to at the moment, to say that if the porters were called, how long did it take them to come to the ward? If the patient had been laid already, then the nurses would have done the necessary duties, because when a patient passes away, there are certain routines that need to be done to make sure that the patient is properly preserved and identified, to avoid issues of the body being missing and so forth. So that is why I'm saying that process in itself, it normally would take anything between 30 minutes to 45 minutes, depending on the availability of the porters in the hospital And if it is a change of shift, then you must know that porters are not only responsible for this particular thing only, they're also responsible for moving patients from casualty to the wards, X-ray and so forth. So it then becomes something that the department needs to establish the timelines of what had happened, who was responsible for doing what and when.
Do you know if this hospital has a permanent CEO?
Not at the moment. They are not having a permanent CEO.
And do you know how long they have not had a permanent CEO?
Yep, I would say it's closer to a year, because that is why I raised it previously to say that organized labor, Denosa being part of that, had raised concerns previously, which led to an interim team that was brought in. And I believe that, I think Dr. Manning, yes, from Rahima Musa is currently managing both Rahima Musa and Helen Joseph, which is actually, it's strenuous. There is no way that you'll be able to manage a mother and child specialist hospital and a tertiary hospital at the same time. And Helen Joseph has got its own share of challenges, being a tertiary institution that does not have a regional or district hospital and CHCs around it that would be feeding to it. So they need to tend to patients even with minor ailments. That is why we've got such a big issues in terms of overcrowding of in the particular facility.
As a final question to you, sir, I suppose what you are explaining now goes to show why there is a crisis at Helen Joseph Hospital. Let me share with you the words of Jack Bloom, who is a member of the legislature, the provincial parliament here in Gauteng. He says, and I quote now, "I think London is lucky to be alive." This is in reference to Tom London, the patients. "I think London is lucky to be alive, as donations have poured in for his transfer to a private hospital where he is now recovering. His dire experience shows that drastic changes are needed in the management of Gauteng public hospitals." And the reason I asked you repeatedly about the CEO question is because he, Jack Bloom, says it is appalling that Helen Joseph Hospital has not had a permanent CEO for years, and promised upgrading has not happened. The department's I Serve with a Smile campaign has clearly failed at this hospital. Let's talk about whether you think the Gauteng Health Department is doing what they are supposed to here, because they seem to claim that whilst the state of the hospital, I'm talking infrastructure now, is indeed a cause for concern. They're saying they are aware and they are trying to deal with it. That as well influences the attitudes of people working within this environment, because if you work in a place that doesn't inspire you, your attitude is also going to reflect possibly the same. Do you think the Gauteng Health Department is doing what it's supposed to, or have done what they were supposed to?
I believe that there's more that can be done, Tolly. You know, the I Serve with a Smile, I think I do believe, and it comes from the Batupili principles. You know, we do need to go back to that. The department needs to do that to make sure that people remember and embrace the principles of Batupili. And by so doing, then you are then able to try and serve with a smile. And with the embracing the principles of Batupili, you then go back to what I mentioned earlier on, addressing issues of infrastructure, a working environment, addressing issues of overcrowding, shortage of nurses or of staff. And then with those being addressed as well, it will also assist in making sure that people are then able to bring in their side of their end and make sure that they serve with a smile. And sometimes, though, it should be put on record that nothing can justify the treatment that Mr. London received from those that were not even able to greet him. It doesn't cost you anything to come into a room and treat a patient. That is the most basic humane thing that you can come in and do. And if you're not able to do that, then it really means that something has gone wrong somewhere and it needs to be corrected.
Bongani Mazibuko, unfortunately, we are out of time. I want to thank you very much for your time. He represents Nursing Union Denosa. He's the Gauteng secretary of that union.